You're standing at the kitchen counter after dinner, hand near the fruit bowl, and you stop. Somewhere along the way, you picked up the idea that fruit and kidneys are a complicated relationship, and you're not entirely sure which side of that line tonight's snack falls on. So you put it back and walk away hungry and uncertain, which feels like the safe choice. Here's what I want to tell you. That hesitation is costing you something real. There are fruits, every one verified kidney-friendly by the National Kidney Foundation, that don't just clear the safety bar. They actively support the work your kidneys are already doing tonight, while you sleep. And the last fruit I'm covering comes with a catch almost no other source mentions, the kind of detail that changes what you put in your cart next time you're at the grocery store. If you want health information that starts with real sources and ends with something you can actually use tonight, that's exactly what Doctor's Plain English is built for. Hit subscribe and tap the bell so you never miss a video. And drop a comment right now. Where are you watching from and what time is it there? I read every single one. I'm Dr. Hannah Fields, and one of the most consistent things I see in practice is patients eliminating entire food categories out of a fear that is real but over-applied. And kidney disease is where that pattern shows up most. Your kidneys filter roughly 200 liters of blood every single day, about 50 gallons, removing waste, balancing fluid, and helping regulate your blood pressure while you sleep. The National Kidney Foundation is clear. Potassium is essential for nerve and muscle function, but damaged kidneys may not clear excess potassium efficiently, which creates genuine risk. So the tension in kidney-friendly eating is this. The antioxidants and anti-inflammatory compounds your kidneys need most are abundant in fruit, but many of the richest sources carry a potassium load that challenges a weakened kidney. The fruits I'm covering today resolve that tension. Real nutrition, low potassium, verified safe at every stage of kidney disease. I think of a patient I'll call Marguerite, 72 years old, managing stage 2 chronic kidney disease, whose story reflects a pattern I see often. She had cut out almost all fruit, reasoning that potassium was risky and fruit had potassium. By the time we sat down together, her evenings were nutritionally bare. She told me that managing her kidneys had come to feel like managing by subtraction, only ever taking things away, never adding anything back. Think of your kidneys' overnight work like a maintenance crew running their deepest cleaning cycle after the building empties out. That crew needs two things: low-pressure conditions, which depend on good sleep, and a steady supply of compounds that neutralize the oxidative buildup from the day. These fruits deliver both. Let's go through them. The first fruit is Tart cherries, and it is the most uniquely nighttime fruit on this entire list. The National Kidney Foundation classifies sour tart cherries as low potassium, under 200 milligrams per serving, low sodium, low phosphorus, and safe at all stages of kidney disease. What makes them specifically valuable at night is phytomelatonin, a plant compound that supports sleep quality. Research published in PMC found that tart cherry juice produced significant reductions in insomnia severity in older adults, with effects comparable to valerian and some melatonin preparations. Here is why that matters for your kidneys specifically. Blood pressure is supposed to drop during sleep, a pattern called nocturnal dipping, meaning the natural overnight pressure decrease your body depends on. When sleep is disrupted, that drop doesn't happen properly, and the kidneys absorb hours of sustained higher pressure that causes cumulative damage over time. Better sleep means that pressure drop happens the way it should. That is protective kidney work, happening every single night. Half to 1 cup of sour Montmorency cherries, or 4 to 8 ounces. Sweet cherries carry a higher potassium profile and are a separate consideration entirely. The second fruit is blueberries. The National Kidney Foundation confirms blueberries are safe at every stage of kidney disease and all dialysis types, with under 150 milligrams of potassium per half cup. The compounds that make them valuable for kidneys are their anthocyanins, the anti-inflammatory molecules behind their deep blue color. Research published in PMC associated 3 servings of blueberries or strawberries per week with meaningful reductions in cardiovascular disease risk through anthocyanin pathways. This matters because cardiovascular disease and chronic kidney disease share the same inflammatory progression. They worsen each other. Slowing that shared process from 1/2 cup addition without adding potassium burden is exactly the kind of efficiency a kidney-friendly diet is built around. 1/2 cup, fresh or frozen. Both preserve anthocyanin content equally well. The third fruit is strawberries. 130 milligrams of potassium per 1/2 cup, the lowest figure of any fruit on this list, and the National Kidney Foundation classifies them as safe for all stages of chronic kidney disease, including hemodialysis and peritoneal dialysis. A clinical study published in PMC found that dietary strawberry supplementation produced significant increases in plasma antioxidant capacity and glutathione levels compared to control groups. Glutathione is the body's primary internal antioxidant system, and oxidative stress is one of the primary drivers of kidney disease progression. 1/2 cup, fresh or frozen. For a more satisfying evening snack, pair with a small spoonful of unsweetened plain yogurt, a complete, kidney-friendly combination. The fourth fruit is cranberries, and this is the one I told you to stay for, because the catch is real. Cranberries have been linked to kidney and urinary tract health for decades, and the research behind that connection is genuine. The NCCIH, part of the NIH, confirms that cranberry products may decrease the risk of recurrent urinary tract infections in women with prior UTIs through plant compounds called proanthocyanins that prevent bacteria from adhering to the bladder wall. But the NIDDK states this directly. Cranberry products do not treat existing bladder or kidney infections. If you have an active infection, cranberries are not a treatment. See a doctor. Now here is the catch. Raw cranberries are intensely tart. Almost no one eats them plain, so most people reach for the sweetened version. Juice cocktails, sweetened dried cranberries, flavored supplements, and the National Kidney Foundation links sugar-sweetened beverages directly to increased kidney disease risk. A product marketed as good for your kidneys can carry enough added sugar to actively work against them. The benefit lives only in unsweetened whole cranberries, unsweetened 100% cranberry juice, or unsweetened dried cranberries in small portions. One more flag. The NCCIH notes conflicting evidence on whether cranberries interact with warfarin. If you take a blood thinner, mention cranberry use to your pharmacist before making it a daily habit. Here is something I am genuinely curious about. Before today, when you reached for fruit in the evening and second-guessed yourself, did you put it back because of potassium specifically, or because you simply weren't sure at all? Tell me in the comments. I find that moment of hesitation really telling, and I read every response. Let me give you 3 principles to carry all of this forward. I call them the overnight filter. Lead with sleep. Tart cherries first, because if your blood pressure doesn't drop overnight the way it should, every other benefit you add works uphill. Stack your antioxidants. Cherries, blueberries, and strawberries together in one small bowl cover more anti-inflammatory territory than any single fruit alone, and all 3 sit safely within low potassium limits at every stage of kidney disease. And know your form. Cranberries must be unsweetened, or the sugar content cancels the benefit entirely. The form is where the benefit actually lives. Marguerite rebuilt her evening routine around exactly this framework. 6 weeks later, her sleep had improved noticeably. Her UTIs, previously occurring almost monthly, had not recurred in 2 months, and her kidney function markers at her quarterly check had remained stable. She told me the biggest shift was psychological. It finally felt like she was adding something to her health instead of only removing things from it. That change in mindset made everything else easier to sustain. Tonight, build the bedtime bowl. 1/2 cup of Tart Montmorency cherries, a handful of blueberries, 3 to 4 fresh strawberries, eaten 30 to 60 minutes before bed. At your next appointment, ask for a basic metabolic panel: creatinine, EGFR, potassium, and phosphorus, so you know exactly where your kidney numbers stand and how much dietary flexibility you actually have. If you are at stage 4 or 5 CKD, confirm any fruit additions with your kidney dietitian before making them a regular habit. And if you take warfarin, speak with your pharmacist about cranberries before adding them. Tart cherries support the sleep that allows your blood pressure to drop overnight, and that drop is protective kidney work happening every single night. Blueberries deliver anti-inflammatory antioxidants at potassium levels, safe for every stage of kidney disease. Strawberries bring the lowest potassium load of any fruit on this list, alongside a measurable boost to your body's internal antioxidant system, and cranberries offer real but specific benefit, only in unsweetened form, never as a treatment for an active infection, and with a conversation with your pharmacist first if you take a blood thinner. The moment I opened with was you putting fruit back and walking away uncertain. Now you know exactly what to reach for, why each one belongs in your evening routine, and which form actually delivers. Thank you for watching all the way through. You came in uncertain about what to eat tonight, and you are leaving with a specific bowl, a clear reason for every ingredient in it, and an honest picture of what each fruit actually does for your kidneys while you sleep. If someone in your life is managing kidney health and still cutting out fruit out of a fear that is broader than it needs to be, share this video with them. It might be exactly what shifts their thinking. Subscribe to Doctor's Plain English for a new video every week, real sources, plain language, and something you can actually use. And one last question for the comments. Which fruit surprised you most today, and are you making the bedtime bowl tonight? Everything I've shared today is for general informational purposes, based on real research and clinical patterns I see often. It isn't a diagnosis, and it isn't a substitute for your own doctor who knows your specific history. Please check with your physician before making any changes to your medications, diet, or health routine.